Cities have always represented a variety of opportunities for a better life, including work, access to healthcare, and access to education, to name a few. Over time, there has been a substantial inflow of people from rural areas into cities. In 1950, just one-third of the world's population resided in cities, with the remainder living in rural areas. This is expected to change in the following decades, with 68% of the world's population expected to reside in urban regions by 2050. While people living in close quarters to each other provides for numerous advantages, such as the rapid exchange of ideas, resources, and services, there is also a serious downside as well. When the World Health Organization offered recommendations on how to lessen transmission when it declared the coronavirus a pandemic in March of this year, their recommendations called for physical separation, regular hand washing, and isolation from others. However, many people who live in metropolitan areas in low and middle-income nations frequently found it difficult or impossible to adhere to such limits. This can be caused by a number of things, such as poor access to clean water and sanitation, which makes it difficult to wash your hands frequently, high population density, where big slums with multiple generations living under one roof make it impossible to physically distance yourself from people, and a sizable portion of the population being dependent on the informal economy. Because they must support themselves and their families, people who rely on informal income do not have a financial safety net from their place of employment and are unable to live independently. These are only a few examples of how urbanization might make it difficult to respond to a pandemic, while also making pandemics more likely. So why then do cities oftentimes create the perfect environment for the development of infectious diseases? 1. Population density. Cities are characterized by their density. Living, traveling, working, and studying close to one another results in more passive interactions between people. The chance of spreading viruses may rise as a result. A domino effect in terms of the contagiousness of viruses and diseases might result from the increased frequency of passive interactions between people caused by high populations, and the greater opportunity for this type of contact to occur due to population density. Every time an infected person comes into contact with another individual, they run the danger of passing the disease to those contacts. In addition, given how quickly some diseases can spread in urban areas, the number of cases may rise quickly, outpacing the ability of health services to control and address disease outbreaks, epidemics, and pandemics, as was the case during the COVID-19 pandemic. 2. Scale. Effective infectious disease response is hampered by the scale of cities. Megacities, or cities with populations of more than 10 million, are becoming more prevalent worldwide. By itself, having this many people live in close quarters can facilitate the spread of infectious diseases. The COVID-19 virus has been severely affecting megacities, including Delhi, New York City, and Sao Paulo, with each city reporting the majority of the confirmed cases in its respective nation. This suggests that megacities and increased virus transmission rates may be related directly. Due to its vast population, New York City saw a serious outbreak at the beginning of the pandemic. Despite the fact that the state is home to some of the greatest hospitals in the nation, questions have been raised regarding whether there are enough intensive care unit beds for patients who have COVID-19 infections that are severe. As ad hoc intensive care units and field hospitals were established as a fallback, they were mainly ineffective because they didn't have the staffing or the equipment needed to make them run effectively. It can be difficult to guarantee that there is an adequate supply of drugs and vaccines to treat and prevent diseases when there are millions of people living in cities. For instance, the world's greatest yellow fever outbreak in 30 years occurred in Angola in 2016. Using vaccinations from the International Coordination Group's emergency stockpile, the nation was able to vaccinate 5.7 million of the city's 7 million residents against yellow fever, with the majority of cases happening in the capital city of Luanda. However, the stockpile ran out even though they still required an additional 1.4 million doses to guarantee coverage in the nation's capital alone. Experts then suggested fractional dosing of the yellow fever vaccination to make up for the shortage of vaccines, giving 1/5 of the necessary dose to temporarily protect against the illness for at least 12 months. As a result, the outbreak in Angola and the Democratic Republic of the Congo, where it had moved from Angola to the area bordering Kinshasa, the capital city of the DRC, was eventually brought under control and stopped. 3. Slums and informal communities. People frequently relocate from rural to urban locations in search of economic opportunities, especially in low and middle-income countries, making it difficult to supply enough decent and affordable housing. Informal settlements and unplanned slums expand as demand outpaces supply. These settlements can increase the risk of infectious diseases in residents because they are overpopulated, inadequately ventilated, and lack proper water and sanitary facilities. For instance, food and water contaminated with human feces that contain the bacterium can spread diseases like cholera and typhoid. Although open defecation is common in both rural and urban regions where these diseases are highly prevalent, they pose an even larger risk where there is crowding and shared water sources. Despite a more than 50% decline in open defecation rates since 2000, 673 million people still lack access to decent restrooms, according to a new United Nations report. In the case of COVID-19, the WHO's suggested prophylactic measures of frequent hand-washing and physical separation have proven to be practically impossible for many people to follow due to the lack of clean water and private living space. 4. Urban air bridges. Aviation has experienced the highest growth in recent years, allowing people to travel to distant locations in a fraction of the time it once took. Flying continues to be a common option for both domestic and international travelers, despite concerns about its effects on climate change. However, COVID-19 and the global lockdown have resulted in the biggest drop in air travel since 9/11. The International Air Transport Association estimates that May 2020 passenger demand decreased by 91.3% from May 2019. Air travel has increased the interconnectedness of our planet, while also speeding up the spread of infectious diseases and viruses between cities. In other words, air travel makes it feasible for a virus to spread across the world rapidly and unnoticed. It is conceivable for a deadly virus to go from Nairobi to London to New York in less time than it takes for a virus to incubate. Tens of millions of passengers also pass through numerous international airports in the world's biggest cities each year, including Dubai International Airport, John F. Kennedy International Airport in New York, and London Heathrow. In addition, travelers can spend hours on end in planes, breathing tiny droplets made by others coughing and sneezing before the air has been filtered. This is in addition to the sheer number of people who come into indirect contact in airports. 22 people who were seated within 7 rows of an elderly man who eventually passed away from atypical pneumonia a few days after the flight were identified with confirmed or probable causes of severe acute respiratory syndrome, SARS, during the 2003 SARS outbreak. The number of international air travelers had doubled since the end of the SARS outbreak in 2003, before the COVID-19 pandemic. The propagation of viruses is becoming easier due to the increased global interconnectedness, urbanization, and unrelenting human encroachment on natural environments. The COVID-19 legacy, though, may have an impact on where we choose to live. If individuals prefer less congested living arrangements, perhaps in the country, what was once a rural-urban migration may eventually reverse. Meanwhile, smart urban design to lessen congestion and provide better access to health and preventative treatments like vaccines can protect the most vulnerable and lessen the possibility and spread of pandemics in the coming years.